Hello friends, myself lecturer Miss Aditi Anil Kushare, Master of Arms in Quality Assurance Techniques. Today we will discuss about the first aid of fractures resuscitation methods from health education and community pharmacy. So topics to be covered from this session are as follows: definition of first aid and first aid of fractures and resuscitation methods. Definition of first aid: the first aid is the provision of the immediate care to a victim with an injury or illness, usually affected by a lay person and performed within a limited skill range. First aid is the normally performed until the injury or the illness is satisfactorily dealt with, such as in the case of small cuts, minor bruises and blisters, or until the next level of care, such as a paramedic or doctor arrives. First aid is an emergency aid or treatment given to someone injured, suddenly ill, etc. before regular medical services arrive or can be reached. Broken bones and fractures. Definition: a break or crack in a bone is called a fracture. In most the cases, the damage to the bone will be under the skin, which is called a closed fracture, but sometimes the bits of the bone can puncture through the skin to become an open fracture. In both the cases, you will need to treat the casualty for the shock. Even if you can't see any blood, the break might have caused some internal bleeding. To break a fully grown bone, a huge amount of force is needed, but bones that are still growing are supple and can split, crack, or bend quite easily, a bit like a twig. Fracture signs. The 7 things to look for are swelling, difficulty moving, movement in an unnatural direction, a limb that looks shorter, twisted or bent, a grating noise or feeling, loss of strength and shock. Types of fractures: green stick fractures. Closed fracture mostly occurs in children. The next, complicated fractures. They occur when the jagged ends of the bone fragments damage blood vessels, nerves or a joint. Broken bones in the chest may penetrate the lung, heart or liver. In fractures of the skull, the brain is usually damaged. Depressed fractures. These occur in the skull when the broken ends of the bones are pressed inwards. Commutated fractures. In these cases, the bone is broken into several fragments. This is serious because there will be muscle damage with the more bleeding at the fracture site. This is the normal bone, transverse, oblique, spiral, comminuted, avulsion, impacted, fissure and green stick. Types of skull fractures are depressed, linear, comminuted and basilar. See this figure. Types of fracture: impacted fracture. After a heavy fall, the fracture may be impacted by the force. For an example, spinal injury, falling from tree. Pathological fractures: these occur when the bone is weakened by loss of calcium, infection or cancer. Minimal cause a break. In such cases, in the old age, the bones are more brittle and they may break spontaneously due to the calcium loss, which is part of the aging process. The next one, that is the stress fractures. Stress caused by the repeated minor trauma, as in the athletic training involved in strenuous training such as jogging or marathon running. Management for these fractures are: if it is an open fracture, cover the wound with a sterile dressing and secure it with a bandage. Apply the pressure around the wound to control any bleeding. Support the injured body part to stop it from moving. This should ease any pain and prevent any further damage. Then next, once you have done this, call the medical help. While waiting for help to arrive, don't move them unless they are in the immediate danger. Then protect the injured area by using bandages to secure it to an uninjured part of the body to stop it from moving. For example, fractures on the arm can be secured with a sling, and a leg with a fracture, it can be tied to the uninjured leg. Keep the checking the casualty for signs of shock. This does not mean emotional shock, but is a life-threatening condition after causing by losing blood. If they lose the responsiveness at any point, open their airway, check their breathing, and prepare to treat someone who become unresponsive. See the diagram. This is in this diagram or picture, the types of fractures are given: closed, open, and open fracture produced by missile. What should be done? Check the danger response, airway, breathing, the blood circulation of the victim, that is DRABC, means danger, response, airway, breathing, and circulation. Always control the severe bleeding before immobilizing any fractures. Place the sufficient padding or to support fracture site. Immobilize the fracture sites. Do not force bones back into the wound. Give the proper padding before the patient is shifted to the hospital, and apply the ice pack on the affected area to reduce the pain and control the swelling. Treat to prevent the shock. Then next, what we learned from this topic: first aid, fractures, resuscitation methods. The learning outcomes are: first of all, definition of first aid and first aid of fracture resuscitation methods. Thank you.